These remarkable tools that we build that can see inside you, that can slice the body from any direction without making a single cut, we really only use when we know somebody is sick. Why are we always using our best tools last rather than first? In a word, I'm an imager. For the past quarter of a century, I've been devising new methods to see inside the body, to catch disease and to promote health. My mission and also my passion, I guess, is to see what was once invisible. There are many things one can do with imaging. In my career, I've actually found myself doing 3 things principally: making it faster, making it better, and then figuring out how to make new discoveries. We are now also using artificial intelligence to warn people before they get sick, to catch diseases like cancer, for example, early enough, in fact, to cure. Here at NYU, there's a real emphasis on excellence empowered by innovation. At the core, there's a kind of entrepreneurial attitude. We have a cadre of engineers and scientists who love building things, who love developing new tools, and they go out and talk to physicians, they go out and talk to biological scientists, and then they design prototypes and work with the physicians or the biologists to test those prototypes and see how well they do solving the problems. Why do we need to rely on MRI alone? What if we could now tie the output of sensors, like your smartwatch or other wearables? What if we could use AI to figure out what's common between the sensor signals and the imaging signals? We could use AI actually to change the data that we gather, and ultimately even to change the machines with which we gather it, which is something I call the Everywhere Scanner Project. Rather than bringing people to our imaging devices to figure out how we could bring imaging to people. That involves designing different MRI machines that could be built into a chair or built into a bed that you might be able to come and sit in a CVS or in your place of work, or ultimately even in your home. There's no reason in my mind why advanced imaging devices could not be an integral part of the future physical exam, because they are in fact tools that extend our natural senses and allow us to see what might be wrong.